answer. The objectives for today's webinar are to examine the impact of future regulations and policy on e-cigarette use, to compare current and future regulations of e-cigarettes, and to predict the impact of future e-cigarette regulations on public health practice, policy, and research. I now present to you today's webinar entitled Examining the Future of E-Cigarette Policy and Regulations, presented by Mr. David Zeller, Director of the Center of Tobacco Products, U.S. Food and Drug Administration. In compliance with ACCME guidelines, the presenter has no financial or other relationships with the manufacturer of services discussed in this educational activity. And now, Mr. Zeller.
Thank you so much, and it's a pleasure to be with you. And the name is Mitch Zeller, not David Zeller. And as I was introduced, I am Director of the U.S. Food and Drug Administration's Center for Tobacco Products. And I'm going to be talking to you about federal regulation of e-cigarettes, which are part of this family of products known as electronic nicotine delivery systems, or ENDS. Here's the agenda for my talk. I'm going to start with the regulatory and legal history when it comes to e-cigarettes in the United States, which relates very much to what we call the deeming rule, the U.S. Food and Drug Administration's final deeming rule from 2016. Take a step back and talk a bit about the public health reality that we are all facing today, those of us in public health and tobacco control when it comes to tobacco use in the United States. And then I'll move on to the historic announcement that FDA Commissioner Scott Gottlieb made on July 28th, announcing a comprehensive new regulatory framework for the regulation of tobacco and nicotine products, lay out the roadmap for what we call a healthier future, and then happy to take any questions from folks at the end. So let's start with the regulatory and legal history of e-cigarettes. In the late 2000s, as the marketplace for e-cigarettes was beginning to take off in the United States, FDA took an enforcement action and tried to prevent the importation of e-cigarettes coming into the United States on the grounds that these were basically unapproved drugs or devices under what I think you all know as the safety and efficacy standard in the Food, Drug, and Cosmetic Act. As soon as that enforcement action was taken, the agency was sued by a number of the importers. And their claim was the only way that we could use the drug and device provisions of federal law is if there was evidence that the products that we were taking the enforcement action against were intended for therapeutic use. And that was actually a winning legal argument in federal court. And initially in the district court level, the district court agreed with the importers, and they issued a preliminary injunction preventing us from moving forward with the enforcement action. The government then appealed that case to the United States Court of Appeals for the D.C. Circuit. And in that case, in 2010, the D.C. Circuit agreed with the district court. They technically affirmed the preliminary injunction that the district court had issued. And the whole case really came down to, if something is a tobacco product, if we're going to take an enforcement action under the safety and efficacy standard, it has to be because there's evidence that that particular product is being marketed for therapeutic purposes. That was not the case for the individual e-cigarette products that the agency took that initial enforcement action against in the late 2000s. And the court contrasted that with what it called customarily marketed tobacco products under the Family Smoking Prevention and Tobacco Control Act. And the essence of the court ruling was, unless there was evidence that an e-cigarette, which meets the statutory definition of a tobacco product, and I'll explain that in a second, is in fact being marketed as a drug, making some kind of claim to treat or cure a disease, help smokers quit. The only way that FDA could regulate them was under the tobacco provisions of the law, after issuing a regulation that deems them to be subject to the tobacco authorities. It all comes down to the definition of a tobacco product. And in the statute, Congress said something's a tobacco product if it is either made or derived from tobacco and intended for human consumption. And it's that second prong of the definition, derived from tobacco, that applies to e-cigarettes. Obviously, there's no tobacco in e-cigarettes, but the nicotine in e-cigarettes is derived from tobacco. And that's the part of the definition that the courts seized on and said that's the only way that FDA could regulate e-cigarettes unless they're making some kind of drug claim, hence the need to do the deeming rulemaking. There was this provision, this word in our statute that says we're going to give you the authority to regulate cigarettes and smokeless tobacco products, but if there are other categories of tobacco products that meet the statutory definition, then you, FDA, can deem them to be within your regulatory reach. And that's what the final deeming rule did. And in August of last year, our final deeming rule began to go into effect, covering tobacco products and components and parts. And as you see on the slide, these are the various categories of products that are now covered by FDA's jurisdictional reach when it comes to the regulation of tobacco products, including all Ns, electronic nicotine delivery cigarettes and e-cigarettes. The deeming rule contained what we called automatic and additional provisions. I just want to walk you through what they are so that you have an understanding of what being regulated means. The automatic provisions and the compliance dates for these provisions vary, but these began to go into effect in August of last year. The automatic provisions include everything from registering and product listing requirements where information needs to be submitted to FDA, reporting ingredients and what we call harmful or potentially harmful constituents to the agency, and then being subject to certain very important prohibitions under the law. And on this slide we point out the prohibition that says you can't make a claim to be light or low or mild without submitting an application to FDA first and getting an authorization to put what's called a modified risk tobacco product claim on the market. Then there were what we call additional provisions dealing with youth access. These all began to go into effect August of last year. So let's start with the regulatory and legal history of e-cigarettes. In the late 2000s, as the marketplace for e-cigarettes was beginning to take off in the United States, FDA took an enforcement action and tried to prevent the importation of e-cigarettes coming into the United States on the grounds that these were basically unapproved drugs or devices under what I think you all know as the Safety and Efficacy Standard in the Food, Drug, and Cosmetic Act. As soon as that enforcement action was taken, the agency was sued by a number of the importers. And their claim was the only way that we could use the drug and device provisions of federal law is if there was evidence that the products that we were taking the enforcement action against were intended for therapeutic use. And that was actually a winning legal argument in federal court. And initially in the district court level, the district court agreed with the importers and they issued a preliminary injunction preventing us from moving forward with the enforcement action. The government then appealed that case to the United States Court of Appeals for the DC Circuit. And in that case, in 2010, the DC Circuit agreed with the district court. They technically affirmed the preliminary injunction that the district court had issued. And the whole case really came down to if something is a tobacco product, if we're going to take an enforcement action under the Safety and Efficacy Standard, it has to be because there's evidence that that particular product is being marketed for therapeutic purposes. That was not the case for the individual e-cigarette products that the agency took that initial enforcement action against in the late 2000s. And the court contrasted that with what it called customarily marketed tobacco products under the Family Smoking Prevention and Tobacco Control Act. And the essence of the court ruling was unless there was evidence that an e-cigarette, which meets the statutory definition of a tobacco product, and I'll explain that in a second, is in fact being marketed as a drug, making some kind of claim to treat or cure a disease, help smokers quit. The only way that FDA could regulate them was under the tobacco provisions of the law after issuing a regulation that deems them to be subject to the tobacco authorities. It all comes down to the definition of a tobacco product. And in the statute, Congress said something's a tobacco product if it is either made or derived from tobacco and intended for human consumption. And it's that second prong of the definition, derived from tobacco, that applies to e-cigarettes. Obviously, there's no tobacco in e-cigarettes, but the nicotine in e-cigarettes is derived from tobacco. And that's the part of the definition that the courts seized on and said, That's the only way that FDA could regulate e-cigarettes unless they're making some kind of drug claim, hence the need to do the deeming rulemaking. There was this provision, this word in our statute that says we're going to give you the authority to regulate cigarettes and smokeless tobacco products, but if there are other categories of tobacco products that meet the statutory definition, then you, FDA, can deem them to be within your regulatory reach. And that's what the final deeming rule did. And in August of last year, our final deeming rule began to go into effect, covering tobacco products and components and parts. And as you see on the slide, these are the various categories of products that are now covered by FDA's jurisdictional reach when it comes to the regulation of tobacco products, including all ENDS, electronic nicotine delivery cigarettes and e-cigarettes. The deeming rule contained what we called automatic and additional provisions. I just want to walk you through what they are so that you have an understanding of what being regulated means. The automatic provisions and the compliance dates for these provisions vary, but these began to go into effect in August of last year. The automatic provisions include everything from registering and product listing requirements where information needs to be submitted to FDA, reporting ingredients and what we call harmful or potentially harmful constituents to the agency, and then being subject to certain very important prohibitions under the law. And on this slide we point out the prohibition that says you can't make a claim to be light or low or mild without submitting an application to FDA first and getting an authorization to put what's called a modified risk tobacco product claim on the market. Then there were what we call additional provisions dealing with youth access. These all began to go into effect August of last year, extending prohibitions that had existed for cigarettes and smokeless tobacco to all the other categories of products that were now regulated by FDA. And this includes the federal minimum age of sale of 18 for tobacco products, a mandatory photo ID check to make sure that anybody under the age of 27 is being checked to make sure that they are over the age of 18, a restriction on vending machine sales unless the vending machine is located in an adult-only establishment where kids have absolutely no access to the facility at all, and a ban on free samples for the newly deemed products. It was a long and lengthy rule, and we felt the need to issue what we call guidances, not just for the regulated industries, but for all interested parties, our colleagues in public health and tobacco control, folks that do work at the state and local level. And so this slide lists the types of guidances that we've issued over the last year and a half to 2 years. Let me just talk about the first one, what we call PMTA for ENDS guidance, and a bunch of acronyms there. I'll explain what it means. PMTA is short for the pre-market tobacco application pathway, which is the likely pathway that ENDS, electronic nicotine delivery systems, including e-cigarettes, will have to go through now that those products are being regulated. When we issued the final deeming rule in May of last year, several months before it began to go into effect, we published a preliminary guidance explaining to all interested parties, but particularly industry, if you're going to be filing this type of application, here's the kind of information that we would like to see in the application. Now this is a guidance, and everything listed here are guidances, so they are not legally enforceable the way final regulations are. But the point of guidance is, especially when it comes to new regulation of products that previously had never been regulated, was to share with all interested parties our best thinking on what needs to be in an application, how to use what's called a master file as part of your application process, what to do about investigational or research use of the products, additional guidances for what goes on inside of vape shops, how to rotate cigar warning labels, and how to deal with certain questions that came up related to free samples. So with that by way of background, where we started with the enforcement actions for e-cigarettes in the late 2000s, the litigation that ensued, and what you need to know about the final deeming rule, let's fast forward to today and set the stage for the Commissioner's July 28th announcement by talking about what we call the public health reality. And you know these numbers. When it comes to adults, with all the progress that has been made since the first Surgeon General's report in 1964, at a time when the adult smoking rate was almost 45%, Huge progress. A 2/3 or more reduction in consumption and prevalence rates for adults. But nonetheless, tobacco use, primarily because of smoking cigarettes, remains the leading cause of preventable disease and death in the United States. And under the analysis that was part of the 50th anniversary Surgeon General's report in 2014, ironically, at a time when consumption and prevalence has been going down, the annual death toll from tobacco use went up because the Surgeon General was able to add to the list of tobacco-related diseases a number of diseases that previously hadn't been on the list. And so this figure of 480,000 Americans dying avoidable, preventable premature deaths every year from tobacco use is actually a conservative figure. And if you do the simple math from the time of the 50th anniversary report 3 years ago, just through mid-century, we're talking about more than 17 million avoidable deaths just in the United States, to say nothing about the global toll. But globally, about a decade ago or so, the World Bank projected that the trajectory for global deaths in the 21st century from tobacco use was 1 billion avoidable deaths globally. Here in the United States, it still remains the leading cause of preventable disease and death. And we know that the overwhelming majority of adult smokers are concerned about their health. And year after year, when the surveys are asked, nearly 70% of them say they want to quit, and they intend to make a quit attempt in the 12 months to come. They don't. Not all of them who say they will make a quit attempt do. And unfortunately, those who do make a quit attempt have a very low success rate. So we see a massive amount of lapse and relapse to cigarette use. When it comes to kids, the numbers on the slide also constitute progress compared to the era of Joe Camel in the late 1980s. But nonetheless, these are unacceptable numbers. Every single day, almost 2,500 kids smoke a cigarette for the first time. And we know that 90% of adults started smoking when they were kids. 95% of adult smokers by the age of 21, they all started smoking when they were kids. And when it comes to the use of e-cigarettes and other ends, this is by far the most popular tobacco product with kids. Using the 2016 data, we know that more than 2 million middle and high school aged kids used e-cigarettes or other ends products. So the question that we at FDA started asking ourselves when Dr. Gottlieb became commissioner in mid-May, which was just a few months ago, is how can we have the greatest impact using the tools and authorities that we have? And here's one of the things that the commissioner said at his July 28th announcement. We find ourselves at a crossroads when it comes to efforts to reduce tobacco use. But if we're going to meaningfully improve public health, we need to be willing to take a hard look at our entire approach. I think the key word on this slide from this quote is crossroads. There's wonderful work that's been underway for decades at the federal, state, and local level in the name of comprehensive tobacco control. And product regulation is the latest addition to the arsenal of tobacco control, comprehensive tobacco control interventions. But we're kind of at a crossroads as a public health and tobacco control community because as we see it over the last decade, with the advent of e-cigarettes and the increased focus, at least in the world of discussion and dialogue on harm reduction, we haven't made a lot of progress and we haven't achieved a lot of common ground. And when it comes to figuring out in a properly regulated marketplace what to make of these emerging technologies, especially something like an e-cigarette that could deliver nicotine into the lungs without having to burn tobacco leaves, inhale that smoke, and inhale the 7,000 chemicals that are in every puff of a cigarette. So on July 28th, the commissioner announced our comprehensive plan, and that's what I'd like to walk you through now. The focus is on combustible cigarettes. At a more recent speech, the commissioner said that nicotine, while highly addictive, is delivered through products on a continuum of risk. And it's the combustible cigarette, he said, where that nicotine delivery leads to incredible amounts of disease and death. And think of that continuum of risk being anchored at one end with the conventional combustible cigarette, and at the other end with what we call medicinal or therapeutic nicotine products, nicotine gum, nicotine patch, nicotine lozenge. And somewhere along the continuum or the spectrum between those two anchor points are the other products that have received so much attention, whether it's smokeless tobacco products, electronic cigarettes and ends, and now the heat not burn technology. What the Commissioner announced on July 28th is that we envision a world using the tools of product regulation, making a long-term and public health investment in this, where cigarettes would still be really dangerous, but they would no longer be able to create or sustain addiction. But also using the tools of product regulation and thinking about how to apply principles like the principle of the continuum of risk. Addicted adult cigarette smokers who still want or need their nicotine could get it from alternative and less harmful, hopefully far less harmful sources than the conventional combustible cigarette. If we do this right, here's what can happen. Over time, we can decrease the likelihood that future generations of kids, those who the tobacco industry had identified as the replacement customers for addicted adult smokers who die or quit, we could use the tools of product regulation not to stop future generations of kids from experimenting, but from preventing that experimentation to lead to regular smoking and addiction. Along the way, we can help many more addicted smokers quit cigarettes by encouraging innovation of less harmful products for adults who need those alternative sources, less harmful forms of nicotine delivery. And given that this is a comprehensive agency-wide approach, where for decades we have regulated nicotine in its medicinal form under the safety and efficacy standard, it's an opportunity to take a fresh look at those authorities and those products as well to support innovation in that space when it comes to medicinal nicotine products and other therapeutic products to help smokers quit. Nicotine and the issues related to nicotine addiction and when the addiction occurs are the centerpiece of this effort. The marketplace for tobacco products continues to change. Each year that goes by, there are new and different types of products that are being introduced around the world. At least in the United States, if you want to put a new product in the market, you have to come through FDA first. But the technology that's getting some attention around the world now, heat not burn, especially in Japan and South Korea and Northern Europe, it's a different type of tobacco product. But whatever the evolution in the marketplace for tobacco products that we are seeing taking place, there's one thing that doesn't change. It remains a marketplace fundamentally for the delivery of nicotine. And so nicotine and how addictive nicotine can be in the combustible delivery form is the center of our efforts. Depending upon that delivery mechanism, nicotine can be incredibly addictive. But I hope we can all acknowledge that nicotine delivery lives on this continuum of risk, as I said, with cigarettes being at the most harmful end. And as regulators, what we're trying to do, building on the Commissioner's announcement on July 28th, is strike the right balance, the appropriate balance between smart regulation and encouraging the innovation when it comes to satisfying and less harmful products for the addicted adult cigarette smokers who need them. And all the while, basing this on an emerging regulatory science base that will inform the regulatory policies that we are in the process of creating. I'd like to now walk you through the specific actions that the Commissioner committed the agency to in the historic July 28th announcement. And it starts with a series of what we call advance notice of proposed rulemakings. And the first one, and the one that's received the most attention, has to do with using the product standard authority, the authority that Congress gave the agency to ban or restrict the allowable levels of ingredients in finished products, to use that authority in the form of an advance notice of proposed rulemaking to look at the question of reducing nicotine levels in combustible cigarettes. We're working on this as we speak. Can't say exactly when it will publish, but when it does, it's going to result in our sharing everything that we know about the science supporting nicotine reduction in combustible cigarettes. But most importantly, we're going to be asking a whole bunch of questions in this advance notice of proposed rulemaking. And on this slide, we list just a couple of the areas where you can expect to see us asking questions that will hopefully elicit new information and thoughts and suggestions for the agency. From issues related to how would manufacturers comply with mandatory reductions in the nicotine levels in cigarettes, to issues related to the potential unintended consequences or unintended effects of such a policy, whether it's compensation, which is a behavioral change where rather than doing something good for the public health, smokers still figure out a way to get the nicotine that they would need from a reduced nicotine cigarette, and there's actually no public health benefit then from the nicotine reduction at all. And the other major unintended effect or unintended consequence being illicit trade. We'll be asking all kinds of questions about those issues, as well as questions related to implementation and enforcement of any such rule. But there's going to be many other opportunities for public engagement and a public dialogue with the agency and with society. And on this slide, we list additional advance notices of proposed rulemaking that the Commissioner announced in July and that we are committed to publishing. One has to do with all issues related to the presence of flavors. And it's not just on the side where flavors are playing a negative role in initiation and in attracting kids. We all have heard the reports that the presence of flavors in e-cigarettes may be playing a potentially beneficial role in helping currently addicted cigarette smokers successfully transition completely away from cigarettes to flavored e-cigarettes. This isn't about the enticement of these products to kids. That goes on the side of the ledger where there would be a public health concern. But we're also going to be asking a series of questions about the potential public health benefits of the presence of flavors in non-combustible products such as electronic nicotine delivery systems. And we're also going to publish an advance notice of proposed rulemaking on an issue that remains with us, and that is what should the regulatory status of so-called premium cigars be? And we will ask questions similar to the questions that we asked about this topic in the deeming rulemaking when it comes to premium cigars, whether it's questions about how to properly define a premium cigar, questions about different patterns of uses for premium cigars compared to other cigars, and questions about whether there are different public health impacts related to potentially different patterns of uses for premium cigars versus other cigars. Also want to let everybody know that we are looking at the Product Standard Authority to reduce the harms associated with non-combustible products. In January of this year, we published the first ever proposed product standard to address the toxicant level in tobacco products. In this case, it was a proposed rule to take down the levels of N-nitrosonornicotine, or NNN, in smokeless tobacco products. NNN is a highly carcinogenic compound found in smokeless tobacco, and we propose to take the levels down to such a way that there would be tens of thousands of fewer cases of oral cancer, thousands of fewer oral cancer deaths. The comment period for that proposed rule closed several months ago. We received almost 8,000 comments in response to that proposed rule, and we're currently going through the methodical process of reviewing each and every one of those comments. The rulemakings alone are not going to result in the kind of transformational change that is possible here. What is absolutely essential is that there be a sustained national dialogue on all of the issues related to nicotine, and a regulatory agency like FDA being bold enough to envision a day where cigarettes are no longer capable of addicting future generations of kids. And on this slide, we list some of the issues that need to be part of that national dialogue. There are profound misperceptions about nicotine safety that the general public holds. In the years that I was consulting and working on issues related to tobacco cessation, I would speak to focus group after focus group of smokers who were resistant to trying nicotine gum patch or lozenge because they thought that nicotine caused cancer. And even though they knew how harmful smoking was and that smoking caused cancer, they were resistant to trying nicotine replacement therapy because they thought they were simply trading one form of cancer for another. That's not true. And if you look at the annual surveys between the people who answer incorrectly, does nicotine cause cancer, and the people who simply don't know the correct answer, somewhere around 2/3 to 70% of the public doesn't understand that nicotine does not directly cause cancer. The continuum of risk issue is very important to engage the general public in. They don't understand that the continuum exists, and so we all need to work to explain what this concept means to the general public. But it gets complicated because the continuum of risk and everything related to harm reduction really only applies to how can we help currently addicted adult tobacco users while protecting kids. No child, no adolescent should be initiating on any nicotine delivering product, regardless of where that product rests on that continuum of risk. There is real harm that can be done when kids experiment with nicotine products. The brain is not fully developed until we are somewhere in our early to mid-20s. And it's the part of the brain related to making wise decisions that develops last. And it explains a lot of the risky behaviors that teens will continue to engage in. So we need to do everything within our power collectively to protect kids while we ask some of these tough questions about continuum of risk and access to alternative and less harmful forms of nicotine for those who need it. So we will be asking those questions when it comes to how can we better help adult smokers, the overwhelming majority of whom wish they weren't smoking, successfully stop smoking. And this also means focusing on vulnerable populations along the way. We've began some very important public education campaigns just within the last week or so when it comes to kids and electronic cigarettes. I hope you're all familiar with our efforts that go back to 2014 that we branded The Real Cost, which has made a major independent impact on reducing the number of kids who would otherwise have gone on to smoke who don't just because they were exposed to our campaign. And just within the last week, we launched the first ever ads under the brand of The Real Cost. And this is an image of what that ad looks like that talks to kids about what happens if their brains get hacked from vaping. I want to move on to the other details and parts of the Commissioner's July 28th announcement as I come to the last sections of this talk. I think everybody is aware that we also announced that we were extending the deadlines for applications for products that were on the market as of the effective date of the final deeming rule, which was August 8th of last year. And before going through the details of what those extensions are, I just want to discuss the rationale for why part of this package of actions includes extensions of time to get certain applications in. We are absolutely committed to encouraging innovation when it comes to access to alternative and less harmful forms of nicotine delivery that in a properly regulated marketplace could make a public health difference. With the extra time, this will inform and give us the time to put the best policies in place, both to protect kids and to help the maximum number of smokers quit. And with that time, we will be able to use that product standard authority that I talked about to address some really important issues that we need some more science on before we can figure out how to use that regulatory tool, whether it's what to do about the safety of the batteries that are in the ENDS products, or what to do to minimize accidental exposure to the e-liquids. So here are the details for newly regulated or newly deemed combustible products that were on the market as of August 8th of last year. Those products now have until August 8th, 2021 to get their applications in. And if it's a newly regulated non-combustible product, they get 1 extra year, August 8th, 2022. Those products can remain on the market until those times, as long as they get their applications in by then. But any product standard that goes into effect in between, these products would have to demonstrate their ability to comply. And as you'll see in subsequent slides, with this extra time, we will be able to issue other guidances and other regulations that will bring about greater consistency and transparency and predictability to the product review process. In explaining what has changed, it's very important to say what hasn't changed. All of those automatic and additional provisions that I mentioned as part of the final deeming rule, no changes there, whether it's registration and product listing, reporting ingredients, not making health claims without submitting an application to us first, and then we deciding whether a health claim can be made, and all of the additional provisions related to youth access. None of that changes. But as I said, with this additional time, there are very important implementing and foundational regulations that, on a very ambitious and aggressive timeline, we will have the opportunity to get out. Whether it's rules for what needs to be in a pre-market tobacco application or PMTA, a rule that would be enforceable, a rule for what needs to be in a substantial equivalence application, a rule that would be enforceable, a rule for modified risk tobacco product applications, enforceable, the tobacco version of good manufacturing practices that we're calling tobacco product manufacturing practices, and as I said, finalizing that preliminary guidance that accompanied the final deeming rule last year for the PMTA pathway for ENDS products. A very ambitious set of actions for the agency to take in the next 4 to 5 years, but we are up to the task. And if we can do all of this, it will be a far more efficient process for all parties. And along the way, we will continue to provide all of the trainings and the webinars and assistance to the companies affected by these rules and regulations to give them assistance along the way. Final section of the presentation, it's like a step back and a summary, what we call the roadmap, just through the lens of the tools of product regulation for a healthier future, acknowledging that this continuum of risk exists. On July 28th, the Commissioner said the following, that we're envisioning a world where cigarettes would no longer create or sustain addiction, and where adults who still need or want nicotine could get it from alternative and less harmful sources. That this needs to be the cornerstone of our efforts, and that all of us need to pursue this with common ground. So think of everything that we're going to be doing. So I lost a slide, so I'm just going to skip to the last slide. Think of all of this as part of a comprehensive plan. Congress entrusted the agency with a public health standard that basically comes down to us assessing what is the net impact at a population level on the kinds of policies that I've described in this talk. What are the positive impacts on cessation? What are the positive impacts on reducing initiation? But at the same time, analyzing and accounting for potential negative impacts, reduced cessation or increased initiation. And we make a massive investment in regulatory science to give us the answers to those questions, to guide our policy thinking. That's our job. We will never forget the responsibility that we have to protect kids, and especially when it comes to a highly addictive drug like nicotine, and the experimentation that kids are going to engage in, and what steps can be taken to minimize the number of kids that become addicted to nicotine when delivered through tobacco products. But a world where kids can't become addicted to cigarettes and where addicted adults have access to less harmful forms, both of tobacco-based nicotine and improved medicinal products with nicotine, we believe is absolutely an achievable vision. So I'll leave you with these questions and then happy to answer any questions that you all have. Are we ready and willing and able to ask some of the tough questions about nicotine that need to be asked of all of us and of society? Long-term use of less harmful products, permanent use of less harmful products for those who need it. Do we have the common ground to get there, to move forward? And can we get there without the common ground? These are the kinds of questions that we need to ponder as we move forward. I want to thank you for the time. You can follow us on Twitter at FDA Tobacco, and I'd be happy to answer any questions that you all have now.
Okay, thank you, Mr. Zeller. We're now open for question and answer. Please feel free to submit your questions in the presenter Q&A pod. So, Mr. Zeller, our first question. How do you respond to patients and professionals who are convinced that
I think it is way too early to make absolute statements. Either they're safer or they're more harmful. I think what's clear from what we do know is it all depends upon how this technology or any of the other technologies like heat not burn and whatever's in the pipeline of the industry, how it all plays out behaviorally at a population level. And I guess at a risk of oversimplification, for me it comes down to two questions. We can apply them to e-cigarettes for the sake of the question that's been asked. Two questions. Who's using the product and how is it being used? If e-cigarettes are being used in a properly regulated marketplace and we're getting large numbers of addicted cigarette smokers to successfully transition completely away from cigarettes to e-cigarettes, separate question about how long they remain on e-cigarettes. But if they're no longer smoking combustible cigarettes, I think we would all agree that that's a good thing. But what if instead of the overwhelming majority of those who are using e-cigarettes, instead of being only e-cigarette users, continue to smoke cigarettes? And what if so-called dual use of cigarettes and e-cigarettes becomes the new normal for the overwhelming majority of e-cigarette users? And what if along the way there's massive sustained use of e-cigarettes, not just minimal experimentation, but massive sustained use of e-cigarettes by kids? So it all comes down to the answer to those two questions. Who's using them and how are they being used? Currently addicted cigarette smokers, especially that subset of smokers unable or unwilling to quit, they know the risks of smoking and for whatever reason they continue to smoke 15, 20, 25 cigarettes a day. If we could get those folks to switch to e-cigarettes, there would be a massive reduction in risk for them. But as I said in one of the closing slides, our job as regulators is to figure out what is the net population level public health impact of any of these technologies and the policies that we would put into place. I would say that we need to have an open mind when it comes to the e-cigarette technology. We need to have an open mind in a properly regulated marketplace. That pulmonary delivery of nicotine without combustion could be something that could be very helpful to a lot of smokers, as long as we minimize the unintended uses along the way.
Thank you. Julie would like to know, what are
well, we
the
know
health
that there's
effects
this
of
concern
flavors
about
from
popcorn lung,
e-cigarettes on lung
and
tissue?
that's something that we are studying and making a major investment in trying to better understand the safety profile of e-cigarettes. And that product standard authority that I talked about down the road is the authority that we could use to address safety issues, armed with the science to support regulatory action on flavors in e-cigarettes to minimize the risk of the presence of flavors in e-cigarettes. We also need to look at the behavioral piece of this. What role are flavors in e-cigarettes playing in attracting kids? What role are flavors in e-cigarettes playing in helping addicted cigarette users successfully transition away from cigarettes? So it's a complicated picture of product safety and behavior. What are the compounds that bystanders are being exposed to? At what levels and what risk does that pose to the bystander? A lot of questions have been asked, and this goes beyond FDA's regulatory reach, about the role of clean indoor air laws when it comes to exposure to the aerosol or the vapor from e-cigarettes. And I know that a lot of our colleagues in tobacco control at the state and local level say the comparator should not be cigarette smoke, the comparator should be clean air. Our job as regulators of the product is to be able to bring back to you the results of the investment in science that we're making, to be able to better define and explain what are the compounds that bystanders are being exposed to, at what levels, and what safety issues do they represent. That is an emerging area of science. What I have heard from our tobacco control colleagues is critical questions about the comparator when it comes to e-cigarette use. And I think the overwhelming majority view in tobacco control is that the comparator should be clean air, not air filled with cigarette smoke. 90% of all adult smokers started smoking when they were kids, and their brains have been rewired. And brains don't know from regulations, and brains don't know from cigarettes, e-cigarettes, gum patch lozenge. All the brain knows is it's been rewired and it is seeking its next dose. So when you see smokers huddled out in the cold smoking a cigarette, it's because the receptors in the brain have fired, and the receptors are saying to the body, get me my next dose, or else you're going to be experiencing more craving and start to experience symptoms of withdrawal. So the brain has been rewired. So in that sense, it's the brain that needs the next dose of nicotine. And we now know that there are many different ways to deliver nicotine to the brain. The most efficient way to deliver nicotine to the brain is to smoke a cigarette, because the cigarette is, I would say, ingeniously designed to deliver nicotine via smoke particles into the lungs and then through the bloodstream and into the brain in less than 10 seconds. Less than 10 seconds. And with the advent of e-cigarette technology, and I'm not saying that e-cigarettes can deliver the nicotine as quickly as a cigarette can, but the metric could be seconds as opposed to the many minutes that it takes for the nicotine to be delivered to those same receptors by gum patch or lozenge. I think of the difference in delivery. If you put a nicotine patch on your arm, it has to be slowly absorbed through the skin and into the bloodstream. So the patch will deliver nicotine to the brain in 45, 60, 90 minutes. Oral form, gum and lozenge, it's faster, but it's still many minutes, 25, 30, 35 minutes. Cigarettes, 7 seconds, 8 seconds. And the receptors are waiting for their next dose. And so I think that we owe it to the 36 million addicted adult smokers in the United States to acknowledge, especially with the tools of regulation that FDA has, that the continuum of risk exists and that there might be a way to get better, satisfying, and less harmful delivery mechanisms for nicotine made available to the smokers who I would say need it.
Thank you. Marilyn would like to know,
Sure.
can you please explain
It's
what
a technology
not burn means,
that's
or what those
the
devices
proprietary work of Philip Morris International. It is not currently for sale legally in the United States, but Philip Morris International has filed marketing applications with FDA, both to sell the product and to make claims for the product. And the way it works is, unlike an e-cigarette, which has no tobacco in it, the so-called heat not burn product has a gizmo that you stick a cigarette-like short-looking cigarette thing into, and there is tobacco in what's called the heat stick, the thing that you stick into the gizmo, and there are computer chips and heating blades inside the gizmo. And the way the technology works is the tobacco inside those cigarette-like units get heated, but the company claims there's no combustion. We're studying all this as part of our review of the application. And the company says that the advantage of this is that you heat the tobacco to a point where it will release tobacco flavor and nicotine and other things, but avoid the harms associated with burning tobacco leaves and then the 7,000 chemicals that are produced from burning and inhaling tobacco leaves. Can't speak publicly about how our review of the application is going, but that's basically the product. It is very different from an e-cigarette. Philip Morris International is selling it in dozens of countries around the world, and according to financial analysts and the media, it is doing very well in Japan and South Korea, not doing as well in Northern Europe.
Okay, well, since we've opened the big tobacco door, this next question is about big tobacco. Can you please comment on big tobacco companies not opposing regulations, as it would force smaller e-cigarette
I can only speak for
companies out of
our
business?
experience
Hence, they can
in the
control our
United
market
States
share.
as the regulators, and I think I can make a generalization that we are talking about an extremely litigious industry. There were lawsuits when our final graphic health warnings rule went into effect 7 or 8 years ago, and the industry prevailed in that litigation, and we are back to doing research to support a new graphic health warnings rule that hopefully will survive the inevitable litigation that will follow. We were reviewing applications for so-called substantial equivalence determinations, and in an attempt to come up with a streamlined approach for certain types of applications, we were sued and had to hold review in abeyance until that litigation moved forward. I think we continue to deal with an industry, just speaking generally, that has the legal right to challenge us in court when we have taken final agency action. And I think it's fair to say that they regularly take advantage of those opportunities. It is ordinarily medium and larger size companies that are able to foot the bill for that litigation.
Cigarettes.
Our initial thinking, but the issue of what should the
products?
scope of a nicotine product standard be will be one of the areas that we will be asking questions about in that advanced notice of proposed rulemaking that I mentioned. Our initial thinking is that this could be the ultimate application of the principle of harm reduction, because what we're thinking is we would apply the product standard to combustible cigarettes and we would not apply it to any non-combustible product. The idea being, in a properly regulated marketplace at a population level, if these genuinely are less harmful ways to get nicotine, address the nicotine levels, do something about the nicotine levels in the most deadly and dangerous product, but do not touch the nicotine levels in the less harmful products. That's the initial thinking, but we're going to open all of that up for public comment, and we welcome any and all thoughts, evidence, suggestions about what the scope of the use of the product standard authority should be to reduce nicotine. So that's a reference to the Tobacco Centers of Regulatory Science, which are these multidisciplinary, multi-center, large research grants that FDA funds, but that are administered by our colleagues in the National Institutes of Health. And the question is fundamentally a question about our use of this thing called the Product Standard Authority. Again, it is the power to ban, with just really one exception related to nicotine, to ban or limit the allowable level of any ingredient, compound, constituent, or additive in a finished regulated tobacco product delivered to the consumer. And as regulators, we say that we can only go as far as the science will take us. And if the science is there to support the use of the Product Standard Authority, we would take that very seriously. I gave you the example of using the Product Standard Authority in a proposed rule to take down the levels of NNN in smokeless tobacco products. I don't want to prejudge the future of that rulemaking, but that's one example of how the power can be used. There are no federal licensing requirements. There may be state or local licensing requirements. But when the final deeming rule began to go into effect August of last year, we began enforcing the youth access restrictions. We had been preparing for many months for that day. And we have conducted thousands and thousands of what we call compliance checks, unannounced visits where a trained and commissioned adult accompanies a minor into either a vape shop or a brick and mortar store that sells e-cigarettes. And in the past, the kid tried to buy a pack of cigarettes or a tin of smokeless tobacco. Since last August, our kids try to buy e-cigarettes and cigars. And unfortunately, we've had to issue thousands of warning letters to brick and mortar retailers and online retailers that illegally sold either e-cigarettes or cigars to kids, and we will continue to aggressively enforce those requirements. I wish I could answer that question. We don't know, but in the various reporting requirements that we have over time, we will get that information on a product by product basis. My understanding is that the nicotine delivery in this whole spectrum of electronic nicotine delivery systems can vary dramatically. There is an additive in e-cigarettes called diacetyl that can sometimes be used as a flavor in e-cigarettes. And there's this term popcorn lung where there can be real damage to lung tissue from people that are in the business of making popcorn and getting exposure to the particles and the microparticles that are floating around in the air, and that can actually damage the lung. And there's a concern that that same compound can be present in the aerosol and the vapor of some e-cigarettes, and that's an example where there is a known public health and safety concern.
Wonderful. Maryland notes that within her state, they currently use the term alternative nicotine products. Might this language cause problems in the future when addressing the difference in tobacco legislation?
I think the answer that it could. Words matter, especially when legislation is being written at any level, federal, state, or local. It's why when I talked about uh, our advanced notice of proposed rulemaking on premium cigars, one of the questions that we're going to ask is a definitional question. What is a true, legitimate premium cigar? And the same kinds of questions and attention to detail need to be focused on rules, regulations, laws that are being considered at the state and local level as well, because the definitions matter. It's become convenient to use this term ENDS, electronic nicotine delivery systems, because it's not just e-cigarettes. It's vape pens and e-hookah and e-cigars and e-pipes. The field was looking for a catch-all term. It's one thing for us, for the sake of a conversation and thinking about policy, to have a catch-all phrase like ENDS or ANDS. But when it comes to writing legislation, it's a very, very important question. Because it comes down to what's in and what's out, and that's the level of detail that folks need to really focus on. Nothing other than I appreciate the time and really, really good questions, some of which obviously I couldn't answer. But that's okay.
Thank you very much,
because to the degree that some of your really excellent questions require more science and more data to be able to definitively discuss impacts, whether it's behavioral impacts or safety and toxicology questions about the products. You're asking all the right questions, and we are all in this together, regardless of our day jobs, whether we are regulators, policymakers at the state and local level, tobacco control program officers. We are all in this together, fighting the best possible fight when it comes to the leading cause of preventable disease and death in the country. And we at FDA appreciate all of your efforts and very much appreciative of the opportunity to talk with you today.